Hi, everyone. Welcome. My name is Andrea Creamer, and I'm the PCN Community Engagement Coordinator. Welcome to DOCTALKS, Supporting Developmental Disabilities and Navigating Medical Supports with Dr. Amy Hung and Pamela Balog. I just wanted to remind you that this session will be recorded and will be available after the event at the www.burnabecoronavirus.com website. We'll also be emailing a link after the event. I also wanted to take a moment to acknowledge that the Burnaby Primary Care Networks respectfully acknowledges that the work we do as individuals and as an organization takes place on the unceded traditional and ancestral lands of the Hul'qumi'num and the Squamish speaking people. We are grateful for the opportunity to work on this sacred and shared territory together. So this afternoon, we are joined by two speakers, Dr. Amy Hung and Pamela Balog. Dr. Hung studied medicine at Queen's University and completed her fellowship in developmental disabilities. She's a family physician practicing in Burnaby. Pamela Balog is the senior manager with Posabilities, where she supports people to live and work in their homes. Thank you and welcome. Dr. Hung?
Hi. Thanks everyone for joining us this afternoon. I'm Amy Hung, a family doctor in Burnaby. I used to work in a clinic in Surrey that focused on primary care for people with developmental disabilities. I'm hoping to share some of that experiences today and talk about how to optimize care for our patient population. I don't have any disclosures, and here are some objectives I'm hoping to cover today. First, how to maximize your visit with the family doctors, and what do you do when you have patients with behaviors that challenge? Because I find that to be a common presentation to the doctor's office. And lastly, we'll just talk a little bit about how to get your care during this pandemic era. As many of you know already, there are some limitations and challenges with primary care in BC, particularly for our patient population. Of course, within the office setting, a lot of times you feel like the appointments are rushed, or if you can, if you can even get appointments with doctors, it's sometimes maybe hard to get in just in time. And bringing patients to the clinic sometimes with in a wait room maybe too crowded, and it end up to be a really stressful experience. And if we do have that delay in care, people may end up going to urgent care or even emergency departments. So what can we do to try to minimize some of these challenges? So here are some steps. A lot of times it's overall trying to let the doctor get to know you as a person, know what you want out of your care, know what you like, what you dislike, and what you value, what's most important to you. A lot of these things take place over several visits, or you can do them during meet and greet. There is a toolkit developed by the Surrey Place, and it covers some of the basics. And you can actually fill it out before you see the doctor, or even email it to a doctor, so they have that to review before they get to meet. They get to meet you. And some of the tools that they cover are some of the key things that I feel it's relevant when I'm meeting a person with developmental disabilities. So I'll go over some of that. First, I find it helpful to know about the triggers for agitation or anxiety. For instance, some people, when they come to the office, if the waiting room is quite crowded, they become anxious. Right. So if we know that ahead of time, then we can try to find them a quiet spot in a waiting room, or even bring them first into the exam room to wait. Okay. The other stressors are even things like doing physical exams. Some of our patients may have sensory issues, and therefore even doing physical exams like blood pressure taking, that can be a really stressful thing for them. And to prepare them for that, we can even do sort of imitations, or even doing social stories or visual tools, gradually build up their capacity to tolerate the blood pressure cuff. Some of these things, if we know ahead of time, then we can plan for more time to prepare them. Another helpful thing is to let the doctor know what's your preferred communication style. Some people express things through words, others through pictures, facial expressions, or gestures. Because it's so variable, I find it helpful to let your doctor know ahead of time so that when they're doing assessments, they know what to pick up on. When you're expressing pain or depression. Um, Everyone expresses differently. And a lot of these times, these observations, may be shared by the caregivers or the support staff. And of course, knowing how to communicate, that would be important when we have to make things like medical decisions. Some patients are able to make decisions independently. Others may require some support, right? So if you need support, it's nice to bring the support person with you during the medical visits, or even identify a substitute decision maker, so that when we're making some decisions, the doctor can always make time to explain these things to your support team. If you do have patients with history of aggression or violent behavior, let your team know ahead of time so they can make the safety arrangements. Sometimes it may be even better to do home visits in that case rather than bringing them out to the clinic. Or if needed, sometimes we do have to use sedatives in order to do certain exams. Overall, we want the experience to see a doctor to be the most comfortable one as possible, right? So, let us know how to help you when you do get scared. For some people, it may be things like having a support person um, or the doctor to hold your hand, right? Do some breathing exercises with you, or some counting exercise, or even explain what the doctor is doing ahead of time, or try to demonstrate on other person. Some of these are just tidbits that we can try to help to ease the medical visits. And I do want to see if I can share this the toolkit with you, so we know how to access it. It's through the Developmental Disability Primary Care Program through Surrey Place. It's a program based out in Toronto. So it goes over what some of the key things that doctors are looking for. Um, when they first meet a patient with developmental disabilities. So things are things, your hobbies, the important people in your life, and then some of the other things I went through, they're all listed here. So it is a really detailed a document. And if you're meeting a doctor for the first time, okay, if you can take time to fill this out beforehand, it really helps the doctor to get to know you so they can create a more patient-centered approach when they're treating you. Okay, and now if going back, yeah, okay. And there are other things that you can do to prepare when you're about to go see a doctor. Let's say if you're uh, coming in with some discomfort of the stomach, right? Even before going to see the doctor, we can ask the support person to see if the patient has additional questions that way they want to ask, and also just complete the checklist, going from head to toe, see if there's any headache or vision changes or poor appetite, and getting as much as information as you can is very helpful, especially for people who have difficulty with expressing themselves. So that includes things like getting collateral from family members, or from people from the day program or other support workers. They would know how they function outside of the capacity of the home, and any behavioral changes. That's also very important. And as mentioned before, you can use things like social stories or role playing to help them prepare, and let them know what to expect when you come to the doctor's office. Another really useful tool is if you have trackers. Let's say A person may be having stomach pain. If you do have trackers that shows, hey, this person actually has not had bowel movements for 4 to 5 days, right? That's a really key thing for us to identify if constipation is a problem. Other trackers include things like medication. How often have the patient had to use things like the PRN meds, or there's a blood pressure changes, or is a seizure acting up? Anything that you think is relevant for the doctor to review, we always welcome you to bring it so we can review together. Okay. Now coming to the logistics of booking appointments. Okay, if you can, when you call our doctor's office, try to book for either the first appointment of the day or the last appointment, so that you do have a little bit more time, and hopefully the room is going to be less crowded. Once you are in the waiting area, see if you can find a quiet spot, or even ask the staff ahead of time to see if they can arrange for exam room so the patient can wait there instead. Other things are, if they are sensitive to fluorescent lighting, let it know ahead of time so we can turn off the light. Okay, anything we can do to make sure it's a comfortable experience for the patient, and to optimize things, we can try to arrange that. Okay. The other interesting thing was, when we have patients waiting, I found some people when they bring their preferred item, so whether it's earmuffs or a doll, or something that they really want to just hang on to, you can bring a preferred item with you while you're waiting for the appointment. Okay, that seems to be more calming. Okay, and also having the support person, right? The person that you've known for a long time to come to accompany you to the appointment. So of course, very comforting. Okay. And once you're on the day of the appointment, make sure you arrive with plenty of time. So there's time for parking and walking to the clinic, and then bring all the medication list or supplements and over-the-counter medications with you, and any tracker sheets that we just talked about. um, this other tool is called My Healthcare Visit. It's different from the previous one because this one focuses on this particular visit, and I find it helpful because you can complete a portion of it beforehand. Okay, so first, you identify why are you going to the appointment. All right, so the staff or family members can help to fill it out first, and then there's a screening from head to toe if there's any other discomfort. Okay, is it pain, is it emotional stress, or is it sleep disruptions, right? We'll try to cover that. Okay, and then I think the important part is there's a area of a summary. Okay, so at the end of the visit, bring this form to the doctors again and ask them, hey, can you help me write down the summary of what we talked about today, so you can have that to take home with you. Okay, and then having a follow-up plan as well. Okay, so it's something for you to refer to once you're at home. Um, so you can fill this out beforehand and also at the end of the visit. Okay, so, and at the doctor's visit, of course, the doctor will ask you some questions. Let the doctor know what's bothering you, and it's helpful to hear from a support person at this point whether they can add in or give prompts to the patient, right? And then if there's any collateral from other people, that's when it's nice to share some of these information. I know sometimes doctors tend to talk fast, so it's totally okay if you want to pause the doctor and ask him to simplify the language or even rephrase some of the things. And I also find it helpful is the support person always they can always simplify the language for me and break things down to smaller chunks. So I find it very helpful to just ask the doctor for more time during the appointment so that they can have so we can have a true conversation. Okay, and after the doctor asks you some questions, it usually comes it follows by then you have the physical exam. We, of course, will always ask for permission to do the exam, right? And then we'll try to take things one step at a time. And then if you are more exposed to physical exam, most of people are okay with it. For those who are more nervous, okay, we should try to demonstrate before doing the exam. And then if we need to, we can take different visits to complete the exam. And then in the end, like I said, we should summarize the visit so you can have that form to take home with you. Okay, so that's how I would try to optimize my doctor's visit. I will do some preparations ahead of time to complete the forms, okay, and gather as much as information as we can to help to make the diagnosis. For some of our population, I find one of the more challenging diagnoses to make is when people present with behaviors that challenge. Okay, so behaviors that challenge is any behavior that can cause harm to yourself, other people, or environment, or any behavior that ends up, limiting the opportunity to participate in programs or outdoor activities. Okay, so it used to be called challenging behavior, but they changed that to something called behaviors that challenge. And I wanted to take some time to talk about this because I do see that as a presenting problem, but also it's a very hard issue to manage from family doctor's point of view, but also when you're from the patient's and the family's point of view too, because sometimes it's hard to identify what exactly is going on. Okay, and then I think for us to first understand it, we should be aware that up to 30% of individuals with developmental disability does do have coexisting autism, and that means sometimes when they want to express things, they may have some challenges in expressing their needs. Okay, and then we do realize that some of the behaviors that challenge, they come from these unmet needs. So um, when we can understand, what's lacking in their environment, then we can better help them, and then hopefully that will lead to less emergency department visits, because oftentimes if these escalating behaviors, they may end up going to the emergency department, and then to help them, they may end up getting unnecessary antipsychotics and lead to polypharmacy down the road. So I find that this model is really helpful for family members to understand what may be the potential causes of behaviors that challenge. It's also very helpful for physicians as well. Okay, so it's the acronym called HELP. So it breaks down to health, environment, lived experiences, and psychiatric disorders. So we'll go into each one in a bit more detail. So health, of course, when your body is under pain or stress, then people can express that discomfort by changing their behavior. Okay, so for instance, some people, if they have heartburn and they're nonverbal, they're expressing maybe that during mealtime they may become much more agitated and they don't want to eat. Okay, and then once you treat the heartburn, then they do feel better. Okay, or other times it could be if they end up having like a ear infection, they may have more head banging behavior, right? So and then we need to treat that medical cause to help with the behavior. um, so that's a health component, and obviously we'll rely that we'll make that diagnosis based on physical exam, but also based on the collateral information provided by the caregivers. Okay, and the second one stands for environment, and also expectations. Okay, so more ideally, people with developmental disability, we should be living in an enabling environment, um, and this usually requires like a multidisciplinary approach. Okay, so basic things like hearing support, visual aids, mobility aids, that should be provided to them, right? So they can do their daily functions ease, hopefully with ease. Okay, people like occupational therapists are really helpful because they may be able to optimize the environment to meet the sensory needs. A speech pathologist can be helpful to improve their functional communication, using new boards or other new devices. Whereas a behavioral consultant can help to understand the context of a new behavior, using like the ABC approach, what's happening before this behavior started, and then what's the consequences of this behavior. Other individuals, like program managers, can ensure there's a sense of inclusion, a variety of activities for our population to participate in, right? So all of these things are environmental changes that we can monitor for and try to optimize so that if so that their needs are met. Okay. And also lastly, I think we also need to routinely monitor our expectations. Sometimes we may be too restrictive of a person's needs, and that can be stressful. At other times, we may underestimate the patient's ability and leave the patient feeling bored or understimulated. Right. So if you're feeling bored by doing a certain activity, then of course that may lead to agitation. Right. So all of these things are we can look into to optimize to help the behavior. The L stands for lived experience, and looking at this component really helps me to remind me to take account of a person's past losses or trauma. A number of our patients also have experienced things like abuse before. Okay, so it just reminds me that we need to take like a trauma informed approach when we're talking to our population. Okay, and we also with the lived experiences, even the more recent stressors. So let's say if they recently just moved to a new environment, meeting new staff, then of course that can be a trigger for behavior change, right? And timing too. We may see more of these behaviors that challenge during periods of transition, going from teenager to adulthood, or if there's any loss of ability or independence as we transition into the elder or even palliative care. Some of these transitions can be associated with behaviors that challenge, and sometimes we do need to step it back, to take a step back and just look at the holistic picture to see what's going on. Like, what would I typically feel if I was going through that process? So I think it reminds me to be aware of the past and current stressors. Okay, taken into account, there are our population usually are very empathetic and they're really sensitive to the environment. If there is a caregiver around us that who is sick, or they have a recent loss of a friend or a roommate that moved away, all of these things can trigger an emotional response, and that can lead to increased agitation. Okay, if we've ruled out all of these health, environmental, and lived experiences, right, and then try to optimize all these things, but they still have these behaviors that challenge, then we can move on to the fourth part, and that's more of the P, the psychiatric disorder. It could be that they're developing a primary mental health concern, and those may require treatment with SSRIs or antipsychotics, right? And they may need referral to psychiatry or the DDMH. Those are some of the services that's available. But I think usually, with behaviors that challenge, a lot of times we may jump directly to using sedatives or antipsychotics to help with managing some of the behavior. But if we do that, sometimes we do overlook some of the other potential causes, and we're not really treating the root cause in those cases. Okay, so when we see patients with behaviors that challenge, I think it's helpful to you to use this approach to help to break things down a bit, and include the multidisciplinary approach to really understand what's going on. And so if I think because we do lack training for family doctors in specializing in people with developmental disabilities. If you are supporting a person, who has behaviors that challenge, I think it's helpful to bring this model to your doctor and share. Maybe we can look at this behavior from this approach and see if there's anything that we can optimize, and come up with a plan that way. Okay. So, to prepare for these office visits overall, I think it's helpful for the doctors to get to know you, your wishes and your values, your goals of care, and optimize the setting and um, give your doctor the most information possible by using some of these tools that we talked about today. Okay. And then the third bit of the presentation is just to talk a little bit about medical care during the pandemic, especially for our population. Most of the family doctors were still offering in-person visits. So a lot of times, maybe we'll do some of the triage and collecting information over the phone first. But if we need to come into clinic, we're still here. Okay, and some of the things we can't really figure out over the phone, we still need to do physical exams. But so we need to be mindful that there's limitations of doing telemedicine. um, and things like life lab, whether it's mobile life labs or actual on-site life lab, they're all still operating. So if you need to go for any routine testing, then we still need to do that. We shouldn't really delay any of our preventative cares either, right? So things like PAPs or mammograms or stool testing, these things are some things that often are neglected in our population, right? So if you are behind on any of these preventions, call your doctors and try to make that appointment. Okay. Oh, the other thing I find is often missed is like the bone mineral density scan. For anyone who is 65 and above, obviously we're already at risk of developing osteoporosis, but even more in our population because we're often wheelchair bound. Okay, which means that you don't have that much weight bearing activity. So our bone density is usually lower. Okay, so that's something to bring up to your doctors about. So, how to prepare for your telemedicine visit? It's similar to what we've done before, but a lot of it, you can do ahead of time and then email to your doctor. Okay, so the tools I talked about, the My Healthcare Visit and some of the tracker sheets, right? You can always, complete it ahead of time and then email to them so the doctor can have time to review it. Okay, if you have something like skin lesions, right? You can take photo, make sure it's clear and focused, and then send that to the doctor. Okay. Ideally, the photo should not have any identifying features in case there's, security privacy issues. Okay. In terms of technical setup, always want to make sure the doctors may call from no caller ID phone call, so don't block their numbers. Okay, and I find it helpful to have the speaker option on the phone so that your support staff can add in information as needed. Okay, if it's video call, then of course testing the link ahead of time will just give you more time so you can talk to the doctors. Okay, some of the other basic things are, making sure that the patients understand what's telemedicine and some of the risk involved in that. So obtaining informed consent that usually requires, explaining some of the risk. Usually, the staff or the caregiver or family members will help with that. And some people, while waiting for the phone calls, may become a bit anxious. So I think it's helpful to let them know ahead of time that may not run on time. Okay, so they're not just sitting by the phone and anxiously waiting for that phone call. And then the last tip is, have the name of your pharmacy handy because then if we need to fax anything, we'll just fax it directly to the pharmacy. Okay. Now, if you do access family doctors or are unable to access family doctors, then we do have the urgent care center within Burnaby, and it's at the Prime Care Medical Center. They with the pandemic and they're operating and are seeing patients in person, thankfully. So you can call ahead of time, call at 5 o'clock, and then tell them if you want to book appointment. Okay. um, if you're going to walk-in clinics or hospitals, um, I find it, because you're seeing a new doctor, the doctor doesn't really necessarily know you or some of your medication. You do have a very limited time to, go over your entire medical history with them. So I find it helpful to complete some of these templates ahead of time. Okay, so I know it's called a COVID-19 hospital transfer form, but it's really not that serious. So we'll go over a little bit of it. Okay, so again, I think these are some of the important things that, if you're going to the emergency department, they need to know, like if you have any allergies or any swallowing difficulties, right? And then if you have a behavioral plan, okay, or advanced care plan, you can bring that with you, okay? If you So some of these we covered before. Okay, if you have, if you want somebody to accompany you to the hospital walk-in, let them know. And then how do you communicate, right? So at a glance, then a doctor will know, okay, what's the method of style I should get my information from you. Okay. um, some of these are, if you're with a walking clinic, if they need to have like new interventions, they may need to talk to a substitute decision maker. And this, if you have any past diagnosis, also on a glance, the walking physician will know right away what were your previous diagnoses. Okay. Um, and this is similar to what we were talking about before. When you're nervous, how do you show it, and how do they help you? Okay, in case, in emergency department can be quite stressful. So in case there's increased agitation, like what's the best way? Should I play some music? Should I dim a light? Right, some of these things, if they know right away, then they can help you more immediately. Okay. And of course, whenever you go to meet new doctors, always bring all your medications with you. Okay. And then let's say if you do end up getting admitted to the hospital, right? Then we do have to consider things like advanced care plan. Okay, and this is a very nice toolkit designed specifically for people with developmental disabilities. Okay, it has different phrases for doctors or family members to use to help to guide, what's the um, what's the wishes and values for the patient. Okay, like is this something that they want? Is eating food something that they really enjoy, right? So in that case, we may consider, maybe G2 maybe further down the line. Okay, because if something that they really value, right, we should know that ahead of time. So it goes over some of those preferences, and you can work through this toolkit with your patients, and family doctors can do that together with you as well. Okay. um, I think this is of course, during the pandemic era, this is another whole new discussion that a lot of us are focusing on. We want to talk about advanced care plan as early as we can. Okay. So, in summary, how do you help your family doctor, and how do you optimize your primary care visits? You want to make sure your doctor gets to know you really well. Okay, share some of the interest. Okay, share some of the activities with you so you know who you are. Okay, we can plan ahead to avoid a lot of these surprises. Bring as much as you information as you can to help them understand what you're experiencing, what your discomforts are, or what can be contributing to your behavior changes. Use some of the tools I've identified, and if you Google Surrey Place Developmental Disabilities Program, you'll find those tools. um, and I want to highlight, a lot of comprehensive care, we do rely on the multidisciplinary care approach, and that's why the primary care network is so helpful. And lastly, your doctors are still seeing patients in person, right? So please feel free to reach out to your family doctors. Okay. And with that, I think that's the end of my presentation.
Thank you so much, Dr. Hung. That was really great. And I'm glad that you've reminded people that physicians are still seeing patients in person. I think it's really important that we remember that right now, for everybody, and especially for vulnerable folks in different populations, like folks with developmental disabilities. Pamela, maybe you could tell us just briefly a little bit about what happens at Posabilities, and maybe also I know we've spoken before about maybe some of the challenges or just even general experiences you've had when supporting clients to find a family physician.
Yeah, thank you very much, Andrea. Wonderful presentation. I can see these toolkits being something that everybody would be able to implement when they're supporting a person with a developmental disability. One of the things that I've experienced is a staff will accompany a person to a medical appointment, and the doctor will write down what the treatment plan is. They get back to, in my case, it's quite often a group home setting, and the staff can't remember what was exactly said. We go to read what was written down by the doctor, and well, not saying anything bad about doctors' writings, but half the time we can't discern what was written. So I see that while you're at the visit, the staff or the person who's accompanying the person to write down what the treatment plan is. Also, when you're in that type of situation, you might not always remember everything that was said. So I really like that toolkit while at the doctor's appointment. And also bringing any type of reports or tracking records with you. In my situation, most of the people that we're supporting may be nonverbal. So you may not be able to have them express that they have pain or where they have the pain. So those tracking tools are very helpful in seeing any type of patterns that may exist, like the sleeping pattern or not eating. When you're talking about someone banging their head, their ear, I've seen that often. And, sometimes, unfortunately, it's just been passed off as a behavior and ignored. Or even just any type of behavior change, not exploring first off that maybe there's a hidden medical condition. And unfortunately, I've seen some situations continue on being untreated to the point where now it can't be treated and the person has, become deaf or become blind because of, a lack of care. So it's taking that onion and peeling off all the possible situations that could be causing the behavior concern, as you said. So thank you very much, Dr. Han, for those tools. I think they're going to be very helpful.
Yeah, I thought, so are we allowed to, I know that those were from a facility center in Toronto, but those can be shared with through the primary care networks.
Yeah, sure.
Yeah, they seemed really clear and useful information, even just the the diagram of help and going through the kind of variety of different steps to assess something seems very useful. And I appreciate that you indicated that that physicians in their training only do a small portion of learning about developmental disabilities, and so this is empowers the patients and the clients to be able to also articulate and come prepared for their appointments. So we are allowed to share those.
Yeah, so I know the physicians who started the DDPCP program, they will love this to be disseminated. And if they have any more questions, they have developed this guideline, and it's published in the Canadian Family Physician Journal. And it's a guideline of how to provide care for adults with intellectual and developmental disabilities. Okay, and it's a very good tool for family doctors, but also any caregivers who are worried about their family or the person they're supporting. Okay, it's very detailed document, so definitely feel free to share this. The group.
That's great. Maybe Dr. Hung, Could you, just speak to briefly, like what it means to be a provider for individuals with developmental disabilities?
Yeah. So um, it's I think it's what family doctors do, right? We do look after a variety of groups of people, and I think this one is particularly challenging, but also rewarding at the same time if you can figure out what is going on. Um, when I did my training in at Queens, we saw patients involved with so many specialists, with seizures and G tubes. I think it's very complex. So for the family doctors, it's a very involved task because you have to work closely with the patients, but also their caregivers. Try to get as much collateral as you can, but also you have to connect really well with the specialist too, right? Because sometimes the communication is not very well connected, right? So specialists may not be talking to each other. So the family doctor will have to be the liaison between everybody, right? So I think it's a very involved task, but that's what also makes it really interesting too, because you learn at the same time, what the different specialist perspective are, or what the support person, they may have a really good connection, and then they can get more information. Anyway, it's a lot of it's kind of like hunting for treasures. You just have to dig deeper until you can find the solution. Yeah, it's
Mhm.
very rewarding once you get there.
Yeah. Pamela, is there like, certain kinds of questions that you support your clients with when they're seeking a family physician, or is there, a strategy to, determine how to attach a client to a family physician?
Well, I think it's very important for the time taken out to find the right physician for the person you're supporting. And if it's not the right fit, then don't stay with that doctor. Go and keep searching, and you'll eventually find the right fit. What I do find is once a doctor accepts one patient with a developmental disability, they end up accepting more. I've knocked on the door of, certain doctors and say, can you take one more person? I have another person who needs a doctor. And they quite willingly accept new patients, even though they say they're full. So and they're very dedicated and go above and beyond with giving the care. And that's the type of doctor you need to find. They are out there. Unfortunately, I've had an experience where the doctor has not provided the amount of time or been flexible enough to, I guess, be able to find out what was going on. They weren't willing to take that time. And so we end up having to find a new physician for that person.
Mhm.
And that's with anything, I guess, in life. Sometimes there's not the right fit. So you have to find that person who's going to be able to provide the type of care that you're wanting for your loved one.
Yeah, definitely. So I'm wondering if either one of you have any questions for each other, as somebody who supports clients and somebody who provides care for some of the clients.
Yeah. So I know with the day programs during COVID, is it still happening?
Our community inclusion programs are open, but on limited capacity, or in some cases, it's a changed type of capacity. So, of course, we have to make sure we have the physical distancing happening. So we used to have maybe 20 persons going to a site. Now it's maybe at different times, altering days, and hopefully one day we will be opening up, and I look at it as another opportunity to reevaluate what type of supports we're providing and what's actually needed in community. And that might change based on the learnings of COVID. How we're doing things today may not be what people need or even want. So we're going to be looking at the services and maybe remodeling in some cases.
Really interesting. Yeah. I always wondered about the programming, because I feel like it's a big component to my patient's day. You know, being able to participate in the programs, right? So for them to make some adjustments, I think it's always I mean, they miss it for some of them.
Yeah, yeah. And in some cases, what I've seen is being in a site where people are going, it's too much stimulation, and we've seen some behaviors. And now that they're going maybe part-time or going different, maybe out in community a bit more, not actually at that site, they're actually doing better. So when you talked about earlier, looking at the environment, that's a big component. And I think sometimes it's overlooked that we just get so used to doing the same thing all the time that we forget to challenge what we're doing. We think what we're doing is the best thing, and that's not always the case.
I think that's really, I think that's well articulated. And I think that this pandemic has made us be able to kind of shift our thinking to, better serving people, and also figuring out, what works best. Yeah. For sure.
One of the things that we like, being able to go to a doctor's appointment, well, now they're calling you when it's time to go in for the appointment. And I'm thinking to myself, why weren't we doing that before? It just makes so much sense that the person,
as opposed to sitting in a waiting room.
Yeah. And meanwhile, the person's getting more anxious and more anxious. By the time they get in to see the doctor, they're, they're overly stimulated. There's no way they're going to sit down and be able to be examined. So why not even stay outside and walk around and enjoy nature? And then when it's your time, when the doctor's actually ready to see you, then walk in.
Yeah, that's great. The small things that you figure out, but that definitely, adds to the level of care that people are receiving.
Mm-hmm.
Well, that's those are the questions on my end. Do either of you have any final thoughts? Well, I thank you very much, both of you. And just a reminder to everyone that the talk has been recorded, so we are able to view it in a few days. It'll be on the www.burnabicoronavirus.com website. Once again, just as a wrap up, I wanted to thank Pamela and Dr. Hung for joining us this afternoon, and thank you for watching.